How to get rid of vaginal yeast infections effectively. Candida is a type of fungus which lives in our body. Yeast infection happens when Candida grow too much in the body system. The good bacteria in your body keeps the yeast from overgrowth. However, when you consume medication such as antibiotics, it kills the good bacteria, thereby allowing the yeast to grow out of control. Yeast infection affects mostly women in the age group of between 16 and 35. Some of the symptoms to help identify this infection are: 1. Burning feeling when urinating. 2. Feel itchy and irritating around vaginal area. 3. White cheesy discharge from vagina. Anything that changes the acidity in the vaginal area and kills the good bacteria can encourage the yeast to grow at a faster rate. Some of the causes are lack of sleep, steroid hormone medication, high intake of sugary and starchy foods, antibiotics, stress, immune-damaging illnesses such as diabetes, oral contraceptives, birth control pills, weakened immune system, steroid drugs, and estrogen replacement therapy. The most common infection is at the vaginal area. You can get rid of these infections by using antifungal medicines which are easily available at the pharmacy. If you see your doctor, he may prescribe over-the-counter, OTC, medicines such as Femstat 3, Monistat 7, Vagistat, Gynotrimin, and Diflucan. Sometimes the infection doesn't respond to these medications. There are other alternatives you can consider. Boric acid capsules is the best natural treatment. Boric acid cures up to 98% of women infected with vaginal yeast infections. You can make your own boric acid suppositories by filling size 00 gelatin capsules with boric acid powder, approximately 600 milligrams. Standard yeast infection treatment is 1 capsule. You insert it into the vagina at bedtime for 2 weeks. Boric acid acidifies the vagina, which restores the natural balance of bacteria and yeast. After 30 days, symptoms may return in some women. For this recurring or chronic infection, you use boric acid as maintenance treatment twice a week for 6 months to 1 year. During your menstrual cycle, your pH changes and this leads to yeast infection. You can use key jelly lubricant because it helps restore the pH balance. The infection may go away within 24 hours depending on the severity of your infections. Oregano oil is very potent against yeast, especially those containing high content of carvacrol, an active ingredient. Just follow the directions on the bottle. This is to be taken internally. Yogurt with active cultures such as acidophilus can be used as a treatment for Candida infections. Insert unpasteurized, plain yogurt with a small spatula or vaginal cream applicator into your vagina at night and wear a pad. Repeat this process for 3 to 7 nights, until the symptoms are gone. You can even have a yogurt every day. By eating a cup of yogurt a day can help to keep the yeast in your body in balance. Make sure when you buy yogurt, it contains healthy active bacteria Lactobacillus acidophilus. After successful yeast treatment, you can take certain precautions to keep the infections under control, such as 1. Avoid douching with water, as this causes an imbalance of the pH in the vagina. 2. Avoid bubble baths. 3. Stop wearing thongs and G-strings that are too tight and leaves no room to breathe. Wear cotton only. 4. Avoid clothing that fits tightly at the crotch. 5. Avoid scented hygiene products, harsh cleansers, perfumed soaps, deodorant, tampons, sanitary pads and feminine deodorant sprays. 6. Wipe your vagina from front to back after every use of the toilet. This prevents bacteria from rectum reaching your vagina. 7. Don't stay in your wet swimsuit after swimming. Change as soon as possible. 8. Stop taking antibiotics. If you have to, then take some probiotics such as acidophilus. 9. Cut down on food which are rich with yeast such as breads, sourdough, bagels, cakes and beer. Whether you've never been treated for a yeast infection before or have repeated infections, you should consult a doctor first. There is no instant remedy for yeast infection. The treatment normally takes 3 to 7 days, sometimes up to 4 weeks. This is because the treatment you choose depends on many factors such as your symptoms and your previous treatments.